So RACGP have just released the 2023.2 KFP exam results, and if you're anything like me, you were sitting there rapidly repeating that refresh page while we waited for those results to become available. They have released the exam report, and I thought it would be worth spending a little bit of time today teasing it apart and having a look at how everyone did. So, without further ado, the exam report breakdown. First of all, happy to report I myself have passed, but I appreciate that not everyone might be in the same boat. Congratulations to everyone that did pass, who can put that kind of part of their life behind them, and to those who weren't successful this attempt, there's a few things we'll talk about momentarily. Now, I myself have had to resit the exam as well, so I was very thrilled to get through this time, and I want to reinforce for those who weren't successful on this sitting that there will be future attempts. So if you didn't get through, I want to remind you things that I really wish someone had told me when I had failed myself. You are not a failure. You are still going to be a fantastic doctor. This does not mean that you're a bad doctor at all. This means that your answering of an exam at this time wasn't what they were looking for, and there is definitely technique to getting through this exam. I also want to point out you're not alone. Again, I've had to reset myself. In this exam alone, over 240 candidates were resitting the exam. 334 people were also not successful. But take some time to reflect. Have a think about where you may have not scored marks, where you may have had marks removed, and take a chance to actually go through the exam report yourself and reflect on the answers you put down. It could be you already know some of the things you got wrong. It may be you know your approach to certain things was wrong, and use this then as a chance to reflect on your practice, your knowledge, your preparation for your next sitting. But take some time off. Reset. Give yourself a chance to breathe. Because there is plenty of time before the next KFP exam, and you don't want to be just spending this entire block of time burning yourself to a crisp so that you sit your next sitting feeling absolutely exhausted. It is important, though, to make a plan for your next attempt, so have some time off now, but set a date, set a time, put it on the calendar, mark it down, a chance for you to get back into it and prepare yourself for the next sitting. Now, a very common question that comes up is, why did it take so long for the exam results to come back up? The exam date was the 7th of July, and of course, results were released on Thursday, the 21st of September. My goodness. Now, I've spoken to lots of people from RACGP about this, and there are very good reasons as to why it does take so long. There's obviously the marking rubric that they use to go through. All the exams have to be disseminated to all their marking doctors. They have to go through using their rubric, look at the answers that are provided. They also need to then review those results. Are there particular areas where people have all put down the same answer or missed answers? Do they need to actually review the question? And if they do, that actually happens. People actually go through and say, hey, the wording of this may have been off, or maybe we weren't quite getting the message across that we wanted to. Maybe we should be looking at adjusting the way we assess this question. Now, they might also go through and review the answers. If everyone's put down particular answers that may not have been part of the rubric, they will go back and review and see if they actually want to put those answers into the rubric. Or if there's something about the wording of the question that's maybe skewed people to think down a different pathway than the people who designed the question may have originally been thinking. Now, of course, that then means they chop and change all those specific answers and questions, but then they have to compile it all into the final exam. They then go through and analyse all the overall marks and then kind of go back to scratch again and decide, well, what about this exam do we need to change, if anything? Are we noticing there's certain problems in certain areas? And only then can they actually go about the final calculations to work out pass marks, who is passing, who is failing. So there is a lot to it. It does take a lot of time. Anyone that's worked in committees will understand that these things take a very long time to happen. Now, if we open up the exam report, and all of these are freely available on the RACGP website, I strongly encourage everyone to go through and actually read the report themselves, but they put up a very important table right at the start about the psychometrics. Now, we do know the mean score, 57.59, the pass mark, the cutoff score, 53.9. So, again, as usual, the mean score is going to be above that pass mark. We know there's a 69.8% overall pass rate with 1,106 candidates sitting. I've kind of exploded out the tables from previous exams as well. Let me just make that full screen for a moment while we talk a little bit here. Important to note, we seem to have a pretty similar pass rate compared to previous exams, with a relatively similar pass mark as well. So this is showing we're getting good consistency between the exams. There is a couple of years, though, where things go up and down. I'm looking straight at you, 2021.2, as well as the incredible pass rate of 2022.1 as well. So it looks like that 12-month block would have been an interesting time to be sitting those exams. Now, from here as well, I think it's if we use some information from another table, we can see here, this is looking at the psychometrics from those who just sat the KFP exam, as well as the correlation between exam rate pass and fail between the 2023.2 AKT and KFP. Now, if you look at the total number of candidates, you can see that there was 1,106 who sat the KFP and 866 who sat in both the AKT and KFP. So this is where we get the roughly 240 odd number who are potentially having repeat sat the KFP, having previously passed the AKT as well. So for those, again, who didn't get a successful result on this sitting, I want to reinforce you are not alone. There are literally hundreds and hundreds of people in your position, and it's all about, if at first you don't succeed, try again. But do look at your approach and acknowledge as well that with each subsequent attempt at sitting, the overall pass rates do drop off, and that this reflects really, I think, that preparation is key. Please, 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 if you are going to be sitting again, don't repeat the same mistakes. Look at the preparation approach that you took. Look at the study material that you read through, perhaps the course that you took, and do something different. Whatever you've done for this sitting may not have worked, but by changing that approach and changing the way you're looking at questions, answering questions, I think that's the best way to set yourself up for success on your next sitting. Now, of course, you're going to have the most success if you practice answering the exam-style questions. Probably the biggest hurdle for this exam is the formatting of your responses. Try and go through some practice exams or practice questions with your peers or a mentor, someone who's had experience in running through this exam, and see if you can catch the specific areas that you're not having success with. Don't forget to take breaks on the day of the exam, and that always makes people say, oh, there's not enough time. I think it's important to take time every now and then, even if it's just 10 seconds, 20 seconds, take your pulse, check in on your headspace, and make sure that you're actually approaching the exam with exam. I keep doing that today. I don't know what's going on. Approaching the exam and your responses in the way that you want to be. Of course, keep calm and focused. Center yourself. I often have like little phrases I'll tell myself to try and make sure I'm keeping that kind of headspace and keeping myself on check. Yep, don't forget there will always be another attempt, one way, shape or form. Now, I went through this exam report as well as previous year's exam reports, and I did find common question aspects. Now, I do have to be mindful. I didn't want to go through each specific question today because I sat the exam. I don't want to be giving anything away that might get myself in trouble with the RACGP. But there are generalities that I was keen to discuss and bring up. Because I think it does help you know some of these things going into the exams. And again, things that I probably wish I had spent more time paying attention to going in myself. Now, common question aspects that do come up time and time again. The first one's going to be around therapeutic drug monitoring and paying attention when they're giving you drug levels. You should be paying some very close attention to those. So the first thing is to practice actually interpreting therapeutic drug monitoring results. Thankfully, there's not that many drugs that we actually have to monitor levels of or understand the interpretation of their serum levels. So it's pretty easy to sit down one day, build yourself a little list, and have a think about the high values and low values, what you would do for each. Now, with that is then adjusting medications based on therapeutic drug monitoring. And this may not actually be the drug that you're monitoring, but rather other drugs that may interact with that medication, as well as the potential adverse effects of being too high or too low. So those clinical signs to look out for that would tie in when would you actually request serum levels or monitoring for that drug. And that could also be things like ECGs as well for QT intervals, things like that. Coming into infectious diseases, this is a big, broad one. I'm very sorry, but the diagnosis and management of common infectious diseases. So, plenty of excellent resources on ETG around this, but also focusing in on the prevention of infectious diseases. And a lot of that comes into our immunisations and immunisation schedule. It's a frustrating reality that you do need to have a good grasp of the immunisation schedule, including age ranges, what immunisations might be applicable to that population, and being aware that that may change depending on if they are of Indigenous or non-Indigenous background. Also, good to have an idea of the antibiotic resistance crisis. It does pop up from time to time, knowing that some antibiotics will not be appropriate to certain infections based around that resistance profile. With mental health, the diagnosis and management of common mental health conditions. Now, they don't tend to be very subtle in the exam, thank goodness. They tend to give you very clear, definite signs, and a common question as well is to ask you to identify what those signs are. So often a good way to kind of get free marks there is to carefully read that stem and tease apart each specific sentence, each specific statement. What are they trying to hint at with that presentation? And of course, there'll often be things that they won't put in there that then provides an opportunity for another question of, well, what other things would you look for? Now, a big topic as well is suicide prevention. So having an idea of what are the appropriate interventions, appropriate screening questions, and appropriate planning devices around kind of the acute and subacute or chronic suicidal ideations, as well as the overarching role of primary care in terms of mental health care. And that involves things like referrals to community psychologists, the use of pharmacotherapy, as well as online programs such as This Way Up for cognitive behavioural therapy. Palliative care, really, they tend to be relatively broad in terms of the principles of palliative care, and probably the most specific questions you'll get will be around, pardon me, the management of pain and other symptoms in palliative care with advanced illness, and usually entering that terminal phase, as well as the role of primary care physicians in palliative care, be that community-based palliative care physicians, yourself in general practice, as well as community palliative care programs, which can be often nursing run as well. Women's health, you are always going to be guaranteed some form of abnormal uterine bleeding question, so have a good grasp of those common gynecological conditions, prevention of STIs, in particular relevant to female populations, as well as the management of menopause, which seems to be one of those things that some GPs struggle with. For some males, it may just be that you don't get many patients presenting for discussions around that. And that may be the particular population that you are looking after, or the fact that some patients are reluctant to discuss women's health issues with male general practitioners. And I think this is also a good chance to also look at our own biases and the things that are stopping us from asking our patients about menopause or menopausal symptoms, and actively making that a part of our routine day-to-day assessments. Children's health, again, it's often those common childhood illnesses, usually infectious in nature, prevention of childhood injuries, and that can tie into non-accidental injuries as well, and the way you would screen for some of those, as well as, of course, the overarching primary care physician involvement in child health care, and often tying in immunisations to that there as well, as we've discussed. Indigenous health, it's looking at often the social and cultural determinants of health for Indigenous Australians, more than necessarily specific chronic diseases, but good to have an idea of the prevalence and risk factors for chronic diseases in Indigenous Australians, with a particular focus on rural and remote communities as well. You should have an idea of the diagnosis management of those conditions and when it's appropriate to be screening for those, the role of primary care in terms of health promotion and making our workplaces a safe and accepting place for Indigenous Australians, and tying in then the cultural safety and respect in providing care for them. Now, I've decided to directly rip, essentially, from the exam report, this final in conclusion box here, because I think it's absolutely packed full of gems that we really should be paying very close attention to. Again, let me make it full screen here. So this is kind of their final chance to say, hey guys, we're seeing this again and again as problems with the way people are answering questions. And again, the first one listed up there is answer the question in the context of the clinical scenario using the information provided. Multiple times, speaking to people from our ACGP, they'll say that we're trying to give you all the information you need in the STEM, and that if the information's not there, you can usually kind of infer, pardon me, you can usually infer that it is either not relevant, not applicable, or will be required to be teased out as a specific request from a question. They don't just try and fluff things up with too many red herrings. It's pretty rare for them to try and trip you up like that. And so if they are giving you information, it does mean something. And think about that in the context of the clinical scenario. Make sure you're actually answering the question that's being asked and that is particular to that patient. So taking into consideration age, gender, comorbidities, and other details they sneak in there. And of course, only answer the number of answers that's requested. And as I've gone on again and again to say, when you see the question saying, please provide 6 answers for blah, write down 1, 2, 3, 4, 5, 6, and making sure you are sticking to one answer, one response per number that you've jotted down. It's a really handy way to make sure that you're not going into that overcoding territory. Be specific in your answers. So again, making sure you are being short, sharp and sweet, answering that question that is being asked, making sure that it's addressing the severity and acuity. So trying to rationalize the treatment that you're providing according to that specific scenario there. And making sure, of course, that you are up to date with the current guidelines. And this often comes back to making sure you've had a good read through of things like ETG and are up to date with your clinical practice. Now, I also wanted to run through some final tips from me, and it all may sound stupid, but be prepared. So make sure that you've actually got yourself a study program to set yourself up to actually pass this specific exam, because it does take a very particular approach, I think, to get through, and it's the technique of the exam sitting that mucks a lot of people up. But of course, you still need to have all that clinical knowledge to actually answer the questions properly, so making sure that you're going through and have that understanding of the exam content as well. As we've said it time and time again, read the question carefully. Make sure that you understand what is being asked and answer that specific piece of information. Because sometimes it's tempting to say, oh, there's this glaring bit of information that I need to get out and let you know that I acknowledge this specific thing, but it may be actually unrelated to what the question wants you to answer. So making sure that you're actually answering that one there. Being specific and concise, so there might be 20 things you would be doing if that patient was in front of you, but if the question's only asking for 5 responses, only give those 5 things. And it can be difficult to tease apart what are the most important things that you think need to be addressed, and that will just come with practice, practice, practice. Consider contraindications to medications. I think this is a bit of a trap for a lot of questions where there may be the usual things we would give or prescribe according to ETG, but due to that specific patient, this is often what they're talking about when they say in the context of the patient or scenario, there may be specific things about that patient that mean you have to actually go to that second or rarely third line treatment option. So making sure that you're checking for those contraindications and, of course, be aware of your mandatory reporting obligations. So I think it's easy to sometimes skip that medical legal aspect of our studies, and it is something that is absolutely fair game in the exam itself. So hopefully that has been helpful to you. Hopefully, again, you have gone through the exam. Congratulations if that is the case. And for those who weren't successful this time, best of luck for your next sitting. So for those of you who are preparing to sit for the KFP, check out the rest of the channel for a heap of different practice questions, and I still intend to run live streams before KFP exams to help you practice in a safe, supported environment to make sure you have the best chance of passing yourself. So I hope to see you there, and otherwise, until next time, catch you.